Alrighty, guys, welcome to more episodes of the Human AI podcast. Today, we're talking about sickle cell anemia. We'll talk a bit about blood cancer and a bit about COPD. I know, diverse topics. Okay,
That's a
let's
great range of
start.
topics. Where do you want to start? Maybe with an overview of sickle cell anemia?
We're going to start with sickle cell. If you look at the channel, guys, there's a part one, so I'm just going to continue with part two of sickle cell. So, yeah, we left off talking about management, and I want to ask why we use 500 milligrams of penicillin twice a day and folic acid 5 milligrams daily for future management after someone leaves the hospital.
Sure. After someone with sickle cell anemia leaves the hospital, penicillin helps prevent infections, especially in young kids, because their immune systems are more vulnerable. Folic acid supports red blood cell production, since sickle cells break down faster than normal.
Why do we need folic acid? Sorry.
Folic acid is crucial because it helps your body make new red blood cells. In sickle cell anemia, red blood cells get destroyed faster, so folic acid supports the increased production needed to replace them.
Hmm.
Folic acid helps by supporting DNA synthesis, which is essential for creating new cells, including red blood cells. It helps your bone marrow produce healthy red blood cells to replace the ones that are lost.
So vaccination required for encapsulating bacteria, and this is because of hyposplenism? I don't understand. Caused by splenic infarction and atrophy.
Sure, in sickle cell anemia, the spleen can get damaged due to blocked blood flow, causing it to shrink or not function properly. This condition is called hyposplenism. Since the spleen usually helps fight off certain bacteria, vaccines are needed to protect against these infections.
I don't understand.
Think of the spleen as a filter for the blood that helps remove bacteria. When it's damaged, it can't do this well. So vaccines help protect against those specific infections.
So, explain to me again, pneumococcus, meningococcus, Haemophilus influenza B, what are all these? Are these the bad guys?
Sure, those are all types of bacteria that can cause infection. So pneumococcus, meningococcus, and Haemophilus influenza B are bacteria that can cause serious infections, especially in people with no spleen or a poorly functioning spleen. That's because the spleen helps fight these encapsulated bacteria. Vaccination is recommended to prevent infections in these cases.
And it says consideration for hydroxycarbamide to increase HbF level. What is all this?
Sure, hydroxycarbamide, also known as hydroxyurea, is a medication that can help increase fetal hemoglobin levels. This is beneficial in conditions like sickle cell disease, where higher fetal hemoglobin can reduce the formation of sickle-shaped cells, improving symptoms and reducing complications.
And why does it do that?
It works by stimulating the production of fetal hemoglobin, which doesn't sickle like adult hemoglobin does. This helps reduce the number of sickled cells, lessening pain crises and complications like organ damage.
I don't understand its function.
No worries. Basically, hydroxyurea boosts fetal hemoglobin, which doesn't sickle. This reduces sickling in red blood cells, easing symptoms for conditions
Yeah,
like
I mean,
sickle cell
how
disease.
does it increase fetal hemoglobin? That's what I'm not understanding.
Got it. Hydroxyurea works by reactivating genes that produce fetal hemoglobin. This shifts the balance from adult hemoglobin to fetal hemoglobin, which doesn't form sickle shapes, improving red blood cell flexibility and reducing complications.
All right, let's talk about life-threatening complications: brain syndrome, chest syndrome, aplastic crisis, acute sepsis.
Sure, in sickle cell disease, life-threatening complications include stroke, known as brain syndrome, acute chest syndrome causing severe lung issues, aplastic crisis, where the bone marrow temporarily stops producing red blood cells, and acute sepsis, a dangerous infection. Each requires immediate medical attention.
Dactylitis?
Dactylitis is painful swelling of the hands and feet, often seen in young children with sickle cell disease. It happens when sickled cells block blood flow in small bones. It's one of the earliest signs of the disease.
I don't understand why it happens.
It happens because sickle-shaped red blood cells get stuck in tiny blood vessels, blocking blood flow. This causes pain and swelling, especially in small bones, like those in the hands and feet. It's a hallmark of sickle cell disease, particularly in young children.
Alrighty.
Got it. Anything else you'd like to know about it?
Um, no, that's fair enough. Let's talk about avascular necrosis of femoral head, how it connects to sickle cell.
Sure. Avascular necrosis of the femoral head in sickle cell disease happens when sickled cells block blood flow to the hip joint. Without enough blood, the bone tissue dies, leading to pain and limited movement. It's a serious complication, often requiring treatment like surgery.
Mm-hmm. Okay, interesting. Um, Can you remind me?
Yeah,
We kind of mentioned this in the part one sickle cell podcast. So blood film, we have polychromasia, nucleated RBCs, Howell Jolly bodies due to hyposplenism. Explain this. Why is spleen suddenly like the main focus of things? I don't understand. We have so many organs in the body. How come sickle cell mainly seems to have a problem with spleen? Also, reticulocytes, please, and explain to me how they connect with polychromasia.
great questions. So, the spleen filters abnormal red blood cells and fights infections. In sickle cell disease, sickled cells get stuck in the spleen, damaging it over time, leading to hyposplenism or functional asplenia. This causes issues like Howell Jolly bodies, nuclear remnants in red blood cells, because the spleen can't remove them. Polychromasia and reticulocytes indicate young, immature red blood cells released into circulation when the body's trying to produce more red blood cells due to anemia.
Hmm.
It's a lot to take in, but it all ties together.
Tell me again about Howell Jolly bodies and polychromasia. I'm confused. Actually, tell me about everything we talked because I didn't understand the last things.
No problem. Let's break it down. Howell Jolly bodies are tiny nuclear remnants in red blood cells, usually removed by the spleen. In sickle cell disease, the spleen doesn't work well, so these remnants stay in the blood. Polychromasia refers to immature red blood cells, or reticulocytes, which the body releases when it's trying to compensate for anemia. So, in sickle cell disease, both are signs of the spleen's dysfunction and the body's response to chronic anemia.
One more time.
Sure, Howell Jolly bodies are nuclear remnants in red blood cells, which the spleen usually filters out. In sickle cell disease, the spleen doesn't function properly, so these remnants remain. Polychromasia is a sign of immature red blood cells, called reticulocytes, released when the body tries to produce more red blood cells due to anemia. These findings show the spleen's dysfunction and the body's response to sickle cell-related anemia.
All right, we need to go forward. Tell me one more time in a different angle because it's not getting in, bro.
Absolutely. Think of Howell Jolly bodies as leftover bits of a cell's nucleus that should be cleared by the spleen. When the spleen isn't working well in sickle cell disease, these bits stay in the blood. Polychromasia shows that the body is pumping out young red blood cells, or reticulocytes, to make up for the anemia caused by sickle cells. So, both are signs of the spleen's role and the body's response to the disease.
Mm-hmm.
Take your time with it. It's a
Can we
complex
can we
topic.
can we talk about hemoglobin electrophoresis a bit? Diagnosis like sickle solubility screening test.
Sure. Hemoglobin electrophoresis is a test that separates different types of hemoglobin in the blood. It's used to diagnose conditions like sickle cell disease by identifying abnormal hemoglobin types, such as hemoglobin S. The sickle solubility screening test is a quick way to detect the presence of hemoglobin S, confirming sickle cell disease if positive.
What's hemoglobin HPLC?
Hemoglobin HPLC, or high performance liquid chromatography, is another precise method to separate and measure different hemoglobin types. It's more detailed than electrophoresis, providing exact percentages of each hemoglobin variant, making it useful for diagnosing and monitoring disorders like sickle cell disease or thalassemia.
What's myelopoiesis? Is it the same with erythropoiesis?
Good question. Myelopoiesis and erythropoiesis are different. Myelopoiesis is the formation of myeloid cells, like white blood cells and platelets, in the bone marrow. Erythropoiesis specifically refers to the production of red blood cells. Both processes are vital for maintaining a balanced blood cell count.
Alright, guys, I'm gonna shift to blood cancer a bit. And we have growth factor. What's GCSF?
Sure, GCSF stands for granulocyte colony stimulating factor. It's a growth factor that stimulates the bone marrow to produce more neutrophils, a type of white blood cell. It's often used in cancer patients to boost their white cell count after chemotherapy, helping reduce infection risk.
So it's a good guy.
Yes, definitely. GCSF is really helpful for supporting the immune system during cancer treatment.
What's an oncogene? And so in a cancer, we have to lose tumor suppressor genes.
An oncogene is a mutated gene that drives cancer growth. Normally, it's involved in cell growth and division, but mutations can make it overactive. Tumor suppressor genes, on the other hand, normally act like brakes on cell division. Losing these brakes due to mutations allows cancer to develop.
What's epigenetic?
Epigenetic changes are modifications that affect gene expression without altering the DNA sequence. They can turn genes on or off through mechanisms like DNA methylation or histone modification. These changes can,
Yeah.
yeah, they're pretty fascinating.
What's aberrant DNA methylation?
Aberrant DNA methylation means abnormal addition of methyl groups to DNA, which can silence genes that should be active or activate genes that should be silent. This can disrupt normal cell functions and contribute to cancer development by turning off tumor suppressor genes or activating oncogenes.
What does the phrase clonal evolution mean?
Clonal evolution refers to how cancer cells accumulate genetic changes over time, leading to diverse subpopulations. These subpopulations can adapt and survive treatments, making the cancer more aggressive and resistant. It's a key concept in understanding cancer progression
Wow, so
and treatment.
interesting. What's leukemia?
Leukemia is a type of blood cancer that starts in the bone marrow and leads to the overproduction of abnormal white blood cells. These abnormal cells crowd out healthy blood cells, affecting the body's ability to fight infections, carry oxygen, and clot blood. There are several types, classified by how quickly they progress and the specific white blood cells affected.
What's myeloproliferative disorders?
Myeloproliferative disorders are a group of conditions where the bone marrow makes too many blood cells. This overproduction can involve red cells, white cells, or platelets, leading to complications like blood clots, bleeding, or transformation into acute leukemia. Examples include polycythemia vera, essential thrombocythemia, and myelofibrosis.
All right, let's talk about myelofibrosis, polycythemia rubra vera, and essential thrombocythemia. Jesus, what's all this, dude?
Haha, it can be a mouthful. Myelofibrosis causes scarring in the bone marrow, leading to anemia and enlarged spleen. Polycythemia vera results in too many red blood cells, increasing blood thickness. Essential thrombocythemia leads to excess platelets, raising clotting risk. All are myeloproliferative disorders.
Mm-hmm. And why do you have splenomegaly in myelofibrosis? Is it okay, it kind of makes sense to hear.
Exactly. In myelofibrosis, the bone marrow gets scarred, so it can't produce enough blood cells.
Guys, let's
The spleen
jump
takes.
to COPD. So, I mean, where do we start with COPD? Is there something with the acronym GOLD?
Absolutely. GOLD stands for Global Initiative for Chronic Obstructive Lung Disease. It's a guideline for diagnosing and managing COPD, including a classification system based on symptoms and lung function tests. It helps determine the severity and best treatment options.
All right. So we have spirometry, let's say.
Exactly. Spirometry is a key test for diagnosing COPD. It measures how much air you can breathe out and how quickly, helping to assess lung function and the severity of obstruction.
And we also have gas transfer, and or no.
Yes, gas transfer tests, like the diffusing capacity of the lungs for carbon monoxide, DLCO, measure how well gases move from your lungs into your blood.
Can we compare
It's used.
spirometry with gas transfers, please?
Sure, spirometry measures airflow and obstruction, like how much air you exhale and how fast. Gas transfer tests, like DLCO, assess how well oxygen and carbon dioxide move between your lungs and blood. Both give different insights into lung function.
Okay. So can we
Glad
go
that
a
helps.
bit? Can we go a bit deeper to this? And also, I want us to add lung volumes and chest X-ray. Let's compare all of these.
Absolutely. Spirometry looks at airflow. Gas transfer measures how well gases move. Lung volumes check the total air your lungs can hold.
Okay,
And
we're
chest
gonna
X-rays.
play a game. We have these four things, right?
All right, let's do it. What's the game?
Um, I want you to add. Do you remember? First of all, remember? Do you remember the first four?
Yes, we've got spirometry, gas transfer, lung volumes, and chest X-ray.
Okay, I
What's
want you
next?
to also add a CT thorax and a VQ scan imaging. Is that okay?
Absolutely.
Okay,
So now we have
so we have six things. Let's play a game where for these six things, we do a round where you tell me one thing about each thing.
sounds fun. Let's start. Spirometry measures airflow. Gas transfer evaluates gas exchange. Lung volumes show total air capacity. Chest X-rays reveal structural details. CT thorax provides detailed cross-sectional images. And a VQ scan assesses ventilation and blood flow in the lungs.
Okay, I'm gonna get an iPad and I'm gonna show you guys my writing because it's really, well, it's not really nice, but it's, I guess, more helpful. Um, all right. Sorry, bro. I'm just taking my time here.
No worries. Take your time.
All right.
I'm here whenever you're ready.
So you said spirometry measures airflow. Okay, let's go again. So then you said gas exchange.
Sure. Spirometry measures airflow. And gas transfer tests measure how well oxygen and carbon dioxide move between your lungs and blood.
And lung volumes.
Lung volumes show the total amount of air your lungs can hold, helping assess restrictive or obstructive patterns.
And then chest X-ray. Uh,
Chest X-rays reveal structural details of your lungs, like detecting infections or abnormalities.
CT thorax.
CT thorax provides detailed cross-sectional images, offering a closer look at lung structure and any abnormalities.
That makes sense. VQ scan. How do we even do this?
A VQ scan involves inhaling a small amount of radioactive material and injecting another into your blood. It checks ventilation and blood flow in your lungs to detect blockages or other issues.
Why is it called VQ?
It's called VQ because it measures ventilation, V, and perfusion, Q. Ventilation is airflow, and perfusion is blood flow in the lungs.
Alrighty.
Glad that helps.
Alright, so tell me more. You said airflow for spirometry. I don't think I would like understand. Tell me more. I don't understand airflow. So go say more.
Sure, spirometry measures how much air you can inhale and exhale and how quickly. It helps identify obstructive lung diseases like COPD by showing reduced airflow.
So wait a sec. So you you said that it measures the volume and the velocity of the flow.
Exactly. Spirometry measures both the volume of air you breathe in and out and the speed of that airflow,
Are you
which
sure
helps
it?
assess
Are
lung.
you sure it does both?
It does. Spirometry results include measurements like FVC, which is the total volume of air exhaled, and
All right.
FEV1,
Cool.
which is the volume exhaled in the first second,
Okie dokie
showing both
dokie.
volume.
Well, why do we care about the first second?
We care about the first second because FEV1 reflects how quickly air can be exhaled, which helps identify airway obstruction. It's a key indicator
Interesting.
in diagnosing. Exactly. It gives a quick snapshot of how well your lungs are working.
Hmm.
It gives a quick look at how open your airways are.
Hmm. Um. Okay. And the gas transfer, is it a machine?
The gas transfer test uses a machine. Yes, it measures how well your lungs move gases like oxygen into your blood, usually involving breathing in a small amount of carbon monoxide.
Can you expand on the gas transfer?
Sure, during a gas transfer test, you inhale a small, safe amount of carbon monoxide. The machine measures how much is absorbed, showing how efficiently your lungs transfer gases to your blood.
So basically, the more that they measure, it means the more gas exchange occurred.
Exactly. A higher absorption level indicates better gas exchange, meaning your lungs are effectively transferring oxygen into your blood.
So okay, let's talk about lung volumes and chest X-ray.
Sure, lung volumes measure the total capacity of your lungs,
How
helping
is it?
identify.
Is it a machine?
Yes, lung volumes are measured with a machine, often using a body plethysmograph or similar device to assess how much air your lungs can hold.
What's the device called? Sir, what's the device called, please? Ah.
The device is called a body plethysmograph. It measures lung volumes by assessing changes in pressure inside a sealed chamber.
Why does it have this funny name?
The name plethysmograph comes from Greek roots, plethysmos meaning increase and graphane meaning to record. It records changes in volume, hence the name.
Hmm. All right, let's talk about this. What's a 6-minute walk test?
The 6-minute walk test measures how far you can walk in 6 minutes. It's used to assess functional exercise capacity, especially in people with lung or heart conditions.
And what's the minimum?
It helps determine how well your lungs and heart work during physical activity and can guide treatment plans.
Okay, and if I walk 10 kilometers is
If
good?
10 kilometers in 6 minutes would be remarkable. Typically, we measure hundreds of meters in that time.
Surely the okay, fair enough. Um, would that be a world record then?
Definitely. That would be superhuman. Usually the distance ranges from around 400 to 700 meters.
Okay, medications. My worst enemy. I never am able to freaking learn medications. Okay, can we talk about it?
Of course, medications can be tricky, but I'm here to help break them down for you.
Trimbo next Haler 88.5. What was this?
It sounds like you're talking about an inhaler, maybe a combination inhaler with numbers like 88.5, which usually indicate the dosages of medication in it. Do you have a specific inhaler in mind?
Yeah, 88.59. What is this?
88.59 typically refers to the doses of medications in a combination inhaler. The numbers often represent micrograms of different active ingredients, like corticosteroids and long-acting bronchodilators. For specifics, it's best to check the inhaler's label.
Trimbo? What is this Trimbo?
Trimbo is a combination inhaler used for COPD and asthma. It contains 3 medications: an inhaled corticosteroid, a long-acting beta agonist, and a long-acting muscarinic antagonist, all
And,
working together to help.
and what are all
It's
these
a
that are working? Tell me each individual of these.
The inhaled corticosteroid reduces inflammation in the airways. The long-acting beta agonist helps relax and open the airway muscles. And the long-acting muscarinic antagonist also helps keep airways open by blocking signals that cause muscle tightening.
Wow, you're so clever. Explain to me again.
Happy to. The corticosteroid reduces swelling in your airways. The long-acting beta agonist relaxes the muscles around your airways. And the long-acting muscarinic antagonist keeps them open by blocking certain signals.
What is this? So we need salbutamol, we need carbocysteine, azithromycin, dude, amoxicillin, prednisolone, dude. These are like, explain, please, please, I beg you.
All right, salbutamol is a quick relief inhaler that opens airways fast. Carbocysteine helps thin mucus. Azithromycin is an antibiotic for infections. And prednisolone is another antibiotic. Prednisolone is a steroid that reduces inflammation.
Let's play the same game. So this time, tell me a fact for. Oh, not a fact. Tell me one thing about carbocysteine, one for azithromycin.
All right, carbocysteine thins mucus, making it easier to cough out. Azithromycin treats bacterial infections, especially respiratory ones.
Why does carbocysteine thin mucus?
Carbocysteine works by breaking down the structure of mucus, making it less sticky and easier to clear from your airways.
I don't understand. Tell me again, it thins mucus because.
Carbocysteine thins mucus by breaking down the bonds that make it thick, so it's easier to cough up and clear from your lungs.
Yeah, how?
It targets the chemical bonds in the mucus, making it less sticky and more watery,
And
which helps
why
our body clear.
and why does cysteine do this and carbo?
Cysteine is a component of carbocysteine. It helps break down the disulfide bonds in mucus proteins, reducing its thickness and making it easier to expel.
Okay, what about azithromycin?
Azithromycin is an antibiotic that stops bacterial growth by interfering with their protein production.
How does it do it? What does it do?
It treats bacterial infections, especially respiratory ones, by preventing bacteria from making essential proteins, which stops their growth.
Treat bacterial infections?
Exactly. It's commonly used for things like bronchitis or pneumonia.
Why do azithromycin do this?
Azithromycin does this by binding to the bacterial ribosome, blocking protein synthesis, which is essential for bacteria to grow and multiply.
What is azithro?
Azithro is short for azithromycin, a broad-spectrum antibiotic used to treat various bacterial infections.
Who comes up with this name?
Pharmaceutical companies, in collaboration with regulatory agencies, create these names based on the drug's chemical structure or function.
Okay, so what in the chemical structure or function of this specific one made them name it like that?
Azithromycin's name is derived from its chemical structure, which includes an azolide ring. The azithro part reflects this, and mycin is a common suffix for antibiotics.
All right, let's talk about amoxicillin now.
Sure, amoxicillin is a penicillin antibiotic that works by interfering with the formation of bacterial cell walls, ultimately causing the bacteria to burst and die.
What does it do? I don't understand. Tell me again.
No problem. Amoxicillin stops bacteria from building their cell walls, which they need to survive. Without a proper cell wall, the bacteria burst and die.
And what in its name shows this?
The cillin suffix indicates it's part of the penicillin family, which are antibiotics that target bacterial cell walls.
Okay, and prednisolone, prednisolone, prednisolone.
Prednisolone is a corticosteroid that reduces inflammation and suppresses the immune system,
What?
often used for conditions like asthma or arthritis.
Tell me again, bro.
Sure, prednisolone helps reduce inflammation by calming the immune response.
Prednisolone helps reduce inflammation by.
By suppressing the immune system's activity, which helps lower swelling and inflammation.
Can you be a bit more specific, perhaps?
Sure, prednisolone reduces inflammation by inhibiting the production of inflammatory chemicals like cytokines, which decreases swelling, redness, and pain.
All right. And how does it do that? Does it have to do with calcium blockers or something?
Not quite. Prednisolone works by entering cells and binding to glucocorticoid receptors, which then alter gene expression to reduce inflammation.
Atorvastatin, omeprazole, ramipril. Can we talk about those?
Sure, atorvastatin lowers cholesterol by inhibiting an enzyme in the liver. Omeprazole reduces stomach acid by blocking proton pumps. Ramipril lowers blood pressure by inhibiting an enzyme involved in blood vessel constriction.
Tell me again, bro.
Cure. Atorvastatin reduces cholesterol production. Omeprazole decreases stomach acid. And ramipril relaxes blood
Dude,
vessels
how
to
am I
lower blood pressure.
supposed to remember all these names, honestly?
It can be tricky. Mnemonics, flashcards, or associating each medication with its purpose can help. Practice and repetition are key.
Okay, let's practice these three then.
Great idea. Let's start with atorvastatin. It's used for lowering cholesterol.
Omeprazole,
Omeprazole is for reducing stomach acid, often used for acid reflux.
how do I remember that this is it?
You can remember omeprazole by associating it with O for acid to recall its action.
How do I associate it with that? That takes the same amount of brain power.
Try visualizing the O as a stomach shape, or linking O to relief from acid.
But this is abstract and not close to reality. This is just tricks, brother. I want the reality.
Got it. For a more practical approach, you can relate omeprazole to its role in managing acid reflux or ulcers. Think about it as your go-to for stomach comfort.
Dude, I got no clue what you're talking about.
No worries. In simple terms, omeprazole reduces stomach acid to help with heartburn or ulcers. Think of it as your stomach's helper.
Hmm.
It's all about making connections that work for you.
Ramipril?
Ramipril lowers blood pressure by relaxing blood vessels. It's
My
often
brothers
used for
and
hypertension.
sisters, I hate drag names. I'm gonna do like a 10-hour huge episode where it's like gonna take me the whole day, and I'm just gonna try to learn drugs. It's gonna be a fun day. Um, okay, preventative management. Let's go back to sickle cell. Let's shamelessly change topics. Antenatal screening, prophylaxis. Okay, explain to me antenatal screening, etymology too.
All right. Antenatal screening refers to tests done during pregnancy to detect conditions like sickle cell disease. Antenatal comes from Latin, ante meaning before, and natal meaning birth.
That makes sense.
Glad it does. It's all about checking for conditions before birth.
Okay, prophylaxis is. Yeah, that makes sense. That makes sense.
Great.
Can you
Prophylaxis means
explain to me again what reticulocytes do exactly? Also, NSAIDs and yeah, why do we need to avoid pethidine? And I also want to ask you again. I know we've been through this again, but I don't understand. Explain to me nucleated RBCs due to marrow stress, polychromasia due to reticulocytes, and Howell-Jolly bodies due to hyposplenism.
sure. Reticulocytes are young red blood cells released when the bone marrow is working hard, like during anemia. NSAIDs are pain relievers that can affect the kidneys. Pethidine should be avoided in sickle cell patients as it can cause seizures. Nucleated RBCs appear due to bone marrow stress. Polychromasia is a
Okay,
sign of increased.
how many things did I ask?
You asked about reticulocytes, NSAIDs, pethidine,
Tell me,
nucleated
no, no, no.
RBCs.
Tell me the number. Tell me the number.
You asked about 5 things:
Okay, perfect.
reticulocytes.
Let's do I'm gonna do a diagram for me. I'm gonna have an iPad to show it to people too soon. Yeah, okay. Let's talk about. Let's go step by step. Tell me the first one.
All right, let's start with reticulocytes. These are immature red blood cells released when the bone marrow is working hard, like during anemia.
And why do we need to? Ah, I see. I see. So it shows that it's working hard. What's the name? Can you explain to me reticulo? Does this reticulo mean?
Reticulum comes from the Latin reticulatus, meaning net-like. It
Mm.
refers to the network-like appearance of ribosomes in these young red blood cells.
Okay, what's the second thing?
Next up, NSAIDs. These are non-steroidal anti-inflammatory drugs that reduce pain and inflammation, but can affect the kidneys,
And
especially in sickle cell patients.
and why do we want non-steroidal?
Non-steroidal means they're not steroids, so they don't have the same side effects like immune suppression, but they still help with pain and inflammation.
Why do steroids do immune suppression? And also, what explain to me the name steroids, and also explain to me what why do we care if it's steroid or not? Is it what's the difference in structure and function?
Steroids mimic hormones like cortisol, which can suppress the immune system. The name steroid refers to their structure, a specific arrangement of carbon rings. We care because steroids have different side effects and uses compared to NSAIDs, including immune suppression.
What does immune suppression mean?
Immune suppression means lowering the immune system's activity, making it less able to respond to infections or inflammation.
Okay, 5 minute break, and I'm remember these three things, the other three, and we're gonna talk about them. Okay.
Sounds good. Take your break and we'll dive back in when you're
Guys,
ready.
you'll see me in 2 seconds, literally. And we're back. Do you remember the three things?
Welcome back. We covered reticulocytes, NSAIDs, and pethidine. Ready for the next?
Yeah, but could you talk a bit louder, please?
Sure thing. Ready when you are.
Tell me the three things, because I'm gonna open a new chat where you talk louder.
All right. We talked about reticulocytes, which are young red blood cells, NSAIDs, which are anti-inflammatory drugs, and pethidine, which we avoid in sickle cell patients.
Why do we avoid it?
We avoid pethidine in sickle cell patients because it can cause seizures and other complications.
Why does it cause it?
Pethidine can build up in the body and lead to toxic effects, including seizures,
Wha-
especially in those with kidney issues.
Why?
It's because pethidine's metabolite, norpethidine, can accumulate, especially when the kidneys aren't filtering properly. This buildup can cause neurotoxic effects like seizures.
All right, and we have two more things. You remember?
Yes, nucleated RBCs and polychromasia. Nucleated RBCs appear when the bone marrow is stressed.
Why?
They appear because the bone marrow releases immature cells when it's working overtime, like in severe anemia.
And is it because it's like malfunctioning because of stress?
Exactly. It's a response to stress, pushing out cells before they're fully mature.
And now, lastly, polychromasia.
Polychromasia indicates increased reticulocytes, showing that the bone marrow is producing more red blood cells to compensate for anemia.
Because reticulocytes have a different color or something?
Yes, they often appear slightly bluer on a blood smear due to residual RNA.
Well, don't we always have reticulocytes though? Why don't we always have polychromasia?
We do always have some reticulocytes, but polychromasia is noticeable when there's an increased number, indicating a higher production of new red blood cells.
Tell me again.
Sure, polychromasia is seen when there's a noticeable increase in reticulocytes, indicating the bone marrow is working harder to produce new red blood cells.
I don't understand.
No worries. Polychromasia just means there are more immature red blood cells than usual, which happens when your body is trying to make more red blood cells quickly.
So usually we have light polychromasia. Now we have heavy.
Exactly. In normal conditions, there's a small number. Polycomasia indicates a higher amount due to increased production.
Got it. Now I'm gonna change your voice. You're too soft in sound. Alrighty. Sickle cell anemia. Let's go forward. So, how do we prevent the stroke? Can you talk to us about the STOP trial in 1998 and the transcranial Doppler scan that predicts stroke?
All right, let's dive in. Preventing stroke mainly involves managing risk factors like high blood pressure, smoking, diabetes, and high cholesterol. Lifestyle changes like healthy eating, regular exercise, and medications if needed are crucial. Now, the STOP trial in 1998 showed that transcranial Doppler ultrasound could predict stroke risk in children with sickle cell anemia by measuring blood flow velocity in brain arteries. If velocities were high, it meant a higher stroke risk, prompting preventative treatment.
What is this transcranial Doppler? Why does it have this name? What's a Doppler?
So, transcranial Doppler ultrasound is a non invasive test that uses sound waves to measure blood flow in the brain's arteries. It's called transcranial because the sound waves pass through the skull. The Doppler part refers to the Doppler effect, which detects changes in the frequency of the sound waves as they bounce off moving blood cells. This helps assess blood flow speed and patterns,
Why does
which can
this
indicate
frequency
risks like
change?
stroke.
Why does this frequency change occur?
The frequency change happens due to the Doppler effect. When sound waves hit moving blood cells, their frequency shifts depending on the direction of the blood flow. If the blood cells are moving towards the ultrasound probe, the frequency increases. If they're moving away, the frequency decreases. This change helps measure how fast and in which direction blood is
But
flowing.
why does this happen? You know what the problem is a lot with the education? We focus so much on what happens, but we kind of ignore why. And I feel like innovation happens when we focus on the why, not on the what happens. Like what happens is very important, but it's like it comes as a result of asking why. So we have to train people to ask why, not just know what happens.
Absolutely. Asking why drives deeper understanding and curiosity. It's at the heart of innovation because it pushes us to explore beyond surface level facts. By understanding the reasons behind phenomena, we can think critically, ask better questions, and develop new ideas. It's about fostering a mindset of curiosity.
All right. So since we said all this pretty stuff, now let's go back to the reason that there is a change in frequency when we hit a wall.
Sure thing. The frequency change with the Doppler effect happens because the motion of blood cells causes the sound waves to compress or stretch. If blood cells move toward the probe, the sound waves compress,
And
raising the
is
frequency.
there an energy change too?
Yes, there is. The energy change is related to the frequency shift. When blood cells move, they alter the energy of the sound waves bouncing back, which is why we can detect changes in flow speed and direction.
So
This energy
so
shift
how does this relate to stroke and why is the risk reduced by exchange transfusions, and why do we have a name to reduce HBS level to below 30%? What's hydroxycarbamide therapy if we're unable to transfuse?
in sickle cell anemia, abnormal hemoglobin causes red blood cells to become rigid, which can block blood flow, increasing stroke risk. Exchange transfusions lower the percentage of sickle hemoglobin, HBS, to below 30%, reducing this risk. Hydroxycarbamide, or hydroxyurea, is a medication that increases fetal hemoglobin, which doesn't sickle, helping reduce complications if transfusions aren't possible.
Explain to me again, brother.
Sure, in sickle cell anemia, the abnormal hemoglobin makes red blood cells stiff and prone to blocking blood vessels, which can lead to strokes. Exchange transfusions reduce the amount of sickle hemoglobin in the blood, lowering stroke risk.
Dude,
Hydroxycarbamide,
can you
also known,
tell me all of this and attack it in a different way because I don't understand.
of course, in sickle cell anemia, the red blood cells can become rigid and block blood flow, which raises the risk of stroke. Exchange transfusions help by replacing some of the sickle cells with normal red blood cells, lowering the sickle hemoglobin level. Hydroxycarbamide is a medicine that helps increase a type of hemoglobin that doesn't sickle, reducing complications.
Okay, the first part I understood. I didn't understand the second.
Got it. So hydroxycarbamide, also known as hydroxyurea, boosts a different type of hemoglobin called fetal hemoglobin. This type doesn't form sickle shapes, so it reduces the number of problematic cells and lowers the risk of complications like stroke.
Hmm. Let's talk a bit more about exchange transfusions.
Sure, exchange transfusion involves removing some of the patient's blood and replacing it with donor blood. This process reduces the proportion of sickle cells in the bloodstream, which decreases the risk of blockages and complications like stroke. It's
Can we over time reduce it a lot, or because it's going to be produced again and again from the bone marrow, we will have problems? Can we do some changes in the bone marrow so it stops producing sickle cells and it produces normal ones?
over time, exchange transfusions can significantly reduce the percentage of sickle cells, but the bone marrow will keep producing them. Bone marrow transplants can potentially cure sickle cell disease by replacing the marrow with healthy donor marrow that produces normal red blood cells. It's a complex procedure, but it offers a potential cure.
Yeah, and I assume it's really expensive.
Yes, bone marrow transplants can be quite expensive and complex. They require a suitable donor and come with risks like graft versus host disease.
Okay,
But for some
okay. So why do we have in sickle disease why do we have these complications like sepsis, bone infarcts, avascular necrosis of femoral heads, gallstones, proliferative retinopathy, osteomyelitis, papillary necrosis?
these complications in sickle cell disease arise because sickle-shaped cells can block blood vessels, reducing oxygen and nutrient delivery to tissues. This blockage causes pain, organ damage, and increases infection risk. For example, sepsis can occur due to a weakened immune system. Bone infarcts, avascular necrosis, and osteomyelitis result from reduced blood flow to bones. Gallstones form due to increased breakdown of red blood cells, and retinopathy can develop from abnormal blood flow in the eyes.
Makes sense. Let's talk about hydroxycarbamide a bit more. So, how does it connect to ribonucleotide reductase inhibitor, induces stress, hematopoiesis, decode all of these weird things, increases in HbF production, reduces WCC and platelets, reduces expression of adhesion molecules, increases nitric oxide production.
Cure. Hydroxycarbamide works by inhibiting an enzyme called ribonucleotide reductase, which reduces DNA synthesis. This stress on the bone marrow triggers it to produce more fetal hemoglobin, HbF, which doesn't sickle. It also reduces white blood cells and platelets, which can help lower inflammation and clotting risks. Plus, it increases nitric oxide levels, which helps dilate blood vessels and improve blood flow.
Dude, it does so much. I don't understand how it does so much. Can we break them down simply? Like break it into three parts and let's tell me the first part and then I'll say, okay, I understood it, and we'll go to the second part.
Sure, let's break it down. First part, hydroxycarbamide blocks an enzyme called ribonucleotide reductase. This reduces DNA production, which stresses the bone marrow. Got it?
Yeah, got it.
Great. Second part, this stress makes the bone marrow produce more fetal hemoglobin, HbF, which doesn't sickle. Ready for the last part?
How does it do the second part?
So the bone marrow responds to stress by increasing fetal hemoglobin, HbF production. This type of hemoglobin doesn't form the sickle shape, so it helps prevent complications. Ready for the final
How
part?
does it do it though? How does it produce it?
Hydroxycarbamide encourages the production of fetal hemoglobin by altering gene expression in the bone marrow. It shifts the balance from producing sickle hemoglobin to fetal hemoglobin. This helps keep the red blood cells in a normal shape.
All right, and third part?
All right, the third part. Hydroxycarbamide also reduces white blood cells and platelets, lowering inflammation and clotting risks. Plus, it boosts nitric oxide, helping blood vessels relax.
Tell me again.
Cure. Hydroxycarbamide lowers white blood cells and platelets, which decreases inflammation and clotting. It also increases nitric oxide, which helps blood vessels relax and improve blood flow.
Hmm. Tell me about globin gene loci. How is this connected to sickle cell anemia?
Sure, the globin gene loci are regions on chromosomes 11 and 6T that code for hemoglobin chains. In sickle cell anemia, a mutation in the beta globin gene on chromosome 11 causes abnormal hemoglobin, leading to the sickle shape of red blood cells.
And what is hemoglobin gene switching?
Hemoglobin gene switching is the transition from fetal hemoglobin production to adult hemoglobin after birth. It involves switching from gamma globin to beta globin gene expression, which can influence conditions like sickle cell anemia.
Interesting. Okay. And what is
Yet,
hereditary persistence of FH?
hereditary persistence of fetal hemoglobin, or HPFH, is a condition where gamma globin production continues into adulthood. This can reduce symptoms in sickle cell disease because fetal hemoglobin interferes with sickling.
Tell me again.
Sure, HPFH is when your body keeps producing fetal hemoglobin even after birth. This can lessen the severity of sickle cell disease because fetal hemoglobin doesn't sickle.
I see. Very interesting.
Glad you found it interesting. Anything else you want to dive into?
Allogenic stem cell transplant?
Allogenic stem cell transplant is a procedure where you receive stem cells from a donor to replace damaged or diseased bone marrow. It's used to treat conditions like sickle cell anemia and certain blood cancers, offering the potential for a cure.
Tell me one more time, sir.
Sure, allogenic stem cell transplant involves transferring healthy stem cells from a compatible donor to a patient. This replaces the recipient's diseased bone marrow, aiming to restore normal blood cell production and potentially cure certain blood disorders.
Tell it to me in a different way because I don't understand.
No worries. Basically, an allogenic stem cell transplant uses healthy stem cells from a donor to replace a patient's damaged bone marrow. This helps the body produce healthy blood cells again.
I see. That makes sense. Let's talk about gene therapy for sickle cell.
Sure, gene therapy for sickle cell aims to correct the faulty gene causing the disease. It involves modifying the patient's stem cells to produce normal hemoglobin, reducing or eliminating symptoms.
Can you expand?
Of course, gene therapy usually involves extracting a patient's stem cells, correcting the gene in a lab, and then reinfusing those cells back. This helps the body produce healthy red blood cells, potentially curing the condition.
Tell me more.
Sure, gene therapy is still being refined, but early trials show promise. It can offer a one-time treatment option, potentially eliminating the need for lifelong transfusions or medications.
Hmm, interesting.
Definitely. It's a hopeful area of research for many blood disorders.
So we want to correct the beta globin mutation, so we will do gene therapy, and we want to increase fetal hemoglobin. Can we talk about BCL11A to reactivate gamma globin 2? And what is gamma globin? And also talk about CRISPR therapy, shRNA silencing.
Absolutely. Gamma globin is part of fetal hemoglobin, which reduces sickling. BCL11A represses gamma globin. By silencing BCL11A using gene therapy or CRISPR, we can reactivate gamma globin, increasing fetal hemoglobin. This helps manage sickle cell symptoms.
I don't understand.
No problem. Silencing BCL11A with gene therapy or CRISPR boosts fetal hemoglobin, reducing sickle cell symptoms. Gamma globin is a component of fetal hemoglobin.
Can we talk about voxelotor?
Sure, voxelotor is a medication that increases hemoglobin's oxygen affinity, reducing sickling in red blood cells. It helps improve anemia and reduce complications in sickle cell patients.
One more time.
Of course, voxelotor binds to hemoglobin, making it hold onto oxygen longer. This reduces the sickling of red blood cells, helping manage sickle cell disease symptoms.
I don't understand how it does it.
Voxelotor works by binding to hemoglobin, increasing its affinity for oxygen. This prevents red blood cells from sickling as easily, reducing blockages and complications.
Can you break it down for me in a different way so I can figure it out?
Sure, Voxelotor attaches to hemoglobin, making it hold oxygen more tightly. This reduces the chance of red blood cells changing shape, which helps prevent blockages and pain in sickle cell
So
disease.
voxelotor attaches to hemoglobin more tightly.
Exactly. It helps hemoglobin keep its shape, reducing sickling and complications.
It helps hemoglobin have its shape. Okay, let's go back to blood cancer. So let's talk a bit about typical histology and morphology of the bone marrow, please.
Sure, in blood cancers, bone marrow histology shows abnormal cells crowding out healthy ones. For example, in leukemia, you might see an overproduction of white blood cells, with blasts taking up more than 20% of the marrow.
What about in myelofibrosis, polycythemia vera, and leukoerythroblastic blood picture?
Sure, in myelofibrosis, the bone marrow shows fibrosis or scarring, and atypical megakaryocytes. Polycythemia vera features increased red blood cells, often with hypercellular marrow. Leukoerythroblastic blood pictures indicate immature white and red cells, common in severe marrow stress.
Tell me again.
Sure, myelofibrosis shows scarring in the bone marrow and abnormal megakaryocytes. Polycythemia vera has too many red blood cells with a very cellular marrow. Leukoerythroblastic pictures show immature blood cells, signaling serious.
Yeah, that makes sense. Can we talk about the JAK2V617F mutation?
Sure, JAK2 V617 mutation is common in myeloproliferative disorders like polycythemia vera. It causes abnormal signaling that leads to excessive blood cell production. This mutation is a key diagnostic marker.
What is it? So growth factors has autonomous signaling, and then point mutation in myeloid cells.
Exactly. The JAK2 mutation leads to constant activation of growth signals in myeloid cells, even without growth factors. This results in uncontrolled blood cell production, a hallmark of disorders like polycythemia vera.
Mm-hmm. Interesting.
Yeah, definitely. It's fascinating how a single mutation can cause such big changes.
Can we talk about how MPDs arise from aberrant JAK-STAT signaling?
Absolutely. Myeloproliferative disorders, or MPDs, often result from mutations like JAK2, causing constant cell growth signals. This leads to an overproduction of blood cells, which can cause conditions like polycythemia vera, essential thrombocythemia, and myelofibrosis. Sure, JAK-STAT signaling is a pathway cells use to communicate signals from outside to inside. When a cytokine binds to its receptor, JAK proteins get activated, which then phosphorylate and activate STAT proteins. These STATs move to the nucleus to influence gene expression. In myeloproliferative disorders, MPDs, mutations in JAK2, like V617F, cause constant activation of this pathway, leading to uncontrolled cell proliferation.
How do we manage the myeloproliferative disorders?
Managing myeloproliferative disorders depends on the specific type. For example, in polycythemia vera, phlebotomy is often used to reduce red blood cells. Medications like hydroxyurea or JAK inhibitors can help control cell growth. For essential thrombocythemia, antiplatelet therapy with aspirin might be used. It's all about reducing symptoms and preventing complications.
Hmm.
It's a lot to take in, right? But the key is focusing on symptom control and preventing issues like blood clots or bleeding. Is there a particular MPD you want to dive deeper into?
So can we talk about management? So hydroxycarbamide, I'm really bad with drugs, dude. So yeah, ruxolitinib, venesection. Let's talk.
No worries, hydroxycarbamide, also called hydroxyurea, is used to lower blood cell counts. It's effective for polycythemia vera and essential thrombocythemia. Ruxolitinib is a JAK inhibitor used for myelofibrosis and polycythemia vera when hydroxyurea isn't enough. Venetoclax is more for specific blood cancers like CLL or AML. How's that so far?
I'm confused. Do we get these names? Ruxolitinib, hydroxycarbamide, and what is venesection for polycythemia? Why do we want to reduce the hematocrit level? And yeah,
Yeah, the names are wild. Ruxolitinib and hydroxycarbamide come from their chemical structures. Phlebotomy or venesection is just a fancy term for removing blood. We do it in polycythemia to reduce hematocrit, which is the proportion of red blood cells in blood. High hematocrit can lead to thick blood, increasing the risk of clots. So, we keep it in check to prevent complications.
interesting.
Glad you found it interesting. Anything else you'd like to know about managing MPDs?
So ruxolitinib is a JAK inhibitor,
Exactly. Ruxolitinib targets JAK1 and JAK2, which helps reduce abnormal cell signaling in conditions like myelofibrosis and polycythemia vera.
and
It's pretty
remind me what a JAK did to us.
sure. JAK proteins, or Janus kinases, are enzymes that help transmit signals from outside the cell to the nucleus. When cytokines bind to their receptors, JAKs get activated, which then activate STAT proteins. This leads to changes in gene expression, impacting cell growth and survival. In MPDs, mutations in JAK2 cause this pathway to be constantly active, leading to overproduction of blood cells.
And what is chronic myeloid leukemia?
Chronic myeloid leukemia, or CML, is a type of blood cancer that affects the bone marrow and blood. It's driven by a specific genetic abnormality called the Philadelphia chromosome, which creates an abnormal fusion gene called BCR-ABL. This gene produces a protein that drives uncontrolled cell growth. CML usually progresses slowly and can often be managed with targeted therapies like imatinib.
So we have too many myeloid cells?
Exactly. In CML, there's an overproduction of mature myeloid cells, especially granulocytes. This leads to high white blood cell counts and can cause symptoms like fatigue, weight loss, and an enlarged spleen.
And what is leukocytosis with primitive myeloid cells and splenomegaly?
Leukocytosis means an increased white blood cell count. When it's with primitive myeloid cells, it suggests immature cells are in the blood, typical of leukemia. Splenomegaly is an enlarged spleen, often seen in conditions like CML due to the spleen filtering excess blood cells.
Tell me again.
No worries, it's a lot to take in. Want to break down any specific part?
All of it.
Got it. Let's keep it simple. Leukocytosis with immature myeloid cells means there's a high number of young white blood cells in your blood, which isn't normal. It's a hallmark of certain leukemias. Splenomegaly, or an enlarged spleen, happens because the spleen is working overtime, filtering all these extra cells.
I don't understand.
That's okay. It's a complex topic. Maybe we can break it down even more. What's the most confusing part for you?
What does leukocytosis mean, and why do we have splenomegaly?
Leukocytosis means a high white blood cell count. It's often a sign of infection, inflammation, or leukemia. Splenomegaly, or an enlarged spleen, happens because the spleen filters blood. And when there are too many cells, it works harder and gets bigger.
And and what is Philadelphia chromosome?
The Philadelphia chromosome is an abnormal chromosome found in some leukemias, like CML. It results from a swap between chromosomes 9 and 22, creating the BCR-ABL fusion gene. This gene produces a protein that causes uncontrolled cell growth.
I don't understand.
Great, glad that helped.
I,
Anything else on your mind?
I do not understand.
No problem. Think of the Philadelphia chromosome as a genetic mix-up that creates a new gene, BCR-ABL. This gene makes a protein that tells cells to grow uncontrollably, which leads to leukemia.
And why is it called Philadelphia?
It's called the Philadelphia chromosome because it was discovered in Philadelphia in the 1960s by researchers Peter Nowell and David Hungerford.
Interesting.
Yeah, it's a fascinating piece of medical history.
Can we talk about the TN22 translocation?
Sure. The translocation between chromosomes 9 and 22 results in the Philadelphia chromosome. Part of chromosome 9 swaps places with part of chromosome 22. This forms the BCR-ABL fusion gene,
Hmm.
which drives the
That makes sense. And what is fish fluorescent in situ hybridization?
FISH, or fluorescence in situ hybridization, is a lab technique used to detect specific DNA sequences on chromosomes. It uses fluorescent probes that bind to parts of the chromosome, helping identify genetic abnormalities like the Philadelphia chromosome.
Tell me again.
Awesome. It's a powerful tool for diagnosing genetic conditions.
Tell me again about this fish.
No problem. FISH is particularly useful in identifying chromosomal abnormalities like translocations, deletions, or duplications. It helps pinpoint genetic changes in cancers or genetic disorders. The bright spots you see under a microscope show where specific DNA sequences are located.
I don't understand. How does this happen?
Okay, think of FISH like using a glowing tag to find a specific part of DNA on a chromosome. Scientists create a probe that matches the DNA sequence they're looking for. This probe has a fluorescent dye, so when it binds to its target DNA, it lights up under a microscope, showing where that DNA is.
I see. Let's talk about BCR-ABL oncogene.
Sure, the BCR-ABL oncogene is the result of that Philadelphia chromosome translocation. It creates a fusion protein with constantly active tyrosine kinase activity, driving uncontrolled cell division. This abnormal signaling is what leads to chronic myeloid leukemia.
Tell me again.
No worries. In simple terms, the BCR-ABL oncogene is a genetic mix-up that makes a protein telling cells to grow nonstop. This out-of-control growth is what causes chronic myeloid leukemia.
Mm-hmm.
It's a key target for treatment, like with drugs such as imatinib, which block that protein's activity.
Was about to ask about imatinib. So it's a BCR-ABL tyrosine kinase inhibitor.
Exactly. Imatinib specifically targets the BCR-ABL tyrosine kinase, blocking its activity. This stops the abnormal cell growth in CML, making it a highly effective treatment.
So it blocks the ATP pocket and inhibits kinase activity.
Exactly. Imatinib fits into the ATP pocket of the BCR-ABL protein, blocking its kinase activity and stopping the uncontrolled cell growth.
Uh-huh. So imatinib
Pretty cool?
normalizes blood counts and spleen.
Yep, it can. Imatinib helps reduce the number of abnormal cells, often normalizing blood counts and shrinking an enlarged spleen in CML patients.
Okay,
It's a
interesting.
major success. Glad finding it
So
interesting.
what's the difference between acute myeloid leukemia then?
The main difference is speed. Acute myeloid leukemia, or AML, progresses rapidly with a lot of immature cells. Chronic myeloid leukemia, CML, progresses more slowly with more mature cells.
Tell me again.
Sure, AML is fast growing with lots of immature cells, while CML is slower with more mature cells. Different pace and cell type.
Hmm.
Different treatments too, based on those differences.
And we have low hemoglobin, high white cells, and what stuff like that.
Exactly. In leukemias like AML or CML, you often see low hemoglobin, high white blood cells, and sometimes low platelets due to the bone marrow
I
being
was
crowded with abnormal.
sorry for interrupting. I was going to ask about platelets and neutrophils why they're low.
No worries. Platelets can be low because the bone marrow is too busy making abnormal white cells, crowding out normal cells. Neutrophils can be high or low depending on the stage and type of leukemia. It varies.
Tell me again about this.
Sure, in leukemia, the bone marrow produces lots of abnormal white cells, which can crowd out normal blood cells. This can lead to low platelets, causing bleeding issues. and neutrophil counts can vary based on the type and stage of leukemia.
Can we talk about the morphology of leukemic blasts?
Absolutely. Leukemic blasts are immature white blood cells. They often have large nuclei with open chromatin and prominent eucleoli. The cytoplasm is usually scant and may appear basophilic. These features help distinguish them from normal cells under a microscope.
Uh-huh.
They look quite different from healthy cells.
What are leukemic blasts? And
Leukemic blasts,
sorry, tell me, yeah.
and in leukemia, these blasts multiply uncontrollably, crowding out normal blood cells.
What are they?
They're essentially baby white blood cells that haven't matured.
Mm-hmm. Interesting. Can we talk about um what a biopsy is? What's a bone marrow biopsy?
Sure, a bone marrow biopsy is a procedure where a small sample of bone marrow is taken, usually from the hip bone. It's examined under a microscope to check for abnormal cells, helping diagnose conditions like leukemia or other bone marrow disorders.
Mm-hmm.
It's a key test for diagnosing blood disorders.
Can we talk about how we'll treat it then? Chemotherapy, supportive therapy, allogenic stem cell transplantation.
Sure, treatment for leukemia often starts with chemotherapy to kill cancer cells. Supportive therapy manages symptoms like infections or anemia. For some, an allogeneic stem cell transplant can provide a potential cure by replacing diseased marrow with healthy donor cells.
So what is this combination regimes and myeloablative cycles of treatment?
Combination regimens use multiple chemo drugs to target cancer cells in different ways. Myeloablative cycles are intense chemo treatments that destroy bone marrow cells before a stem cell transplant. This wipes out the diseased marrow, making space for healthy donor cells to grow.
But what exactly is this?
So chemotherapy uses drugs to kill cancer cells. Supportive therapy helps with side effects and complications. An allogeneic stem cell transplant replaces the patient's bone marrow with healthy marrow from a donor, aiming for a long-term cure.
And supportive therapy, we have antibiotics, antifungals, transfusion of blood and platelets.
Exactly. Supportive therapy includes antibiotics for infections, antifungals for fungal infections, and blood or platelet transfusions to manage anemia or bleeding. It supports the body during intense treatments.
Hmm. All right. Why do we have the word allogenic in allogenic stem cell uh, transplantation? And what is an allograft?
Allogeneic means the donor stem cells come from another person, not the patient. An allograft is the actual transplant of these donor cells. This is different from autologous, where a patient's own cells are used.
And why do antifungals help?
Antifungals are used because patients with weakened immune systems, like those undergoing chemotherapy, are at higher risk for fungal infections. They help prevent or treat these infections.
I see. Let's talk a bit about chemotherapy drugs. So we have DNA damaging drugs, we have that induce cellular apoptosis. Can you explain to me what's going on here? We have cytarabine, daunorubicin.
Sure, chemotherapy drugs work in various ways. DNA damaging drugs like daunorubicin cause breaks in DNA leading to cell death. Others, like cytarabine, interfere with DNA synthesis, stopping cells from dividing. This triggers apoptosis, or programmed cell death.
Explain to me more.
Basically, chemo drugs disrupt cancer cells' ability to grow and divide, pushing them into self-destruct mode.
And what is this daunorubicin and anthracycline citarabine nucleoside analog? Dude, where are these names coming from?
The names usually reflect their chemical structure or origin. Daunorubicin is an anthracycline, a class of antibiotics that interfere with DNA. Cytarabine is a nucleoside analog, meaning it mimics DNA building blocks, disrupting synthesis. The rubicin and aridine suffixes hint at their origins and structures.
Hmm. And then what's azacitidine and venetoclax?
Azacitidine is a hypomethylating agent. It incorporates into DNA and reduces abnormal methylation. Venetoclax is a BCL2 inhibitor, promoting cancer cell death by blocking a protein that helps them survive.
Okay.
They're part of the newer targeted therapies.
Can we talk more about stem cell infusion into patient? Talk to me about the initial conditioning regime. Yeah. Why do we need prophylactic antifungals?
Sure. Before a stem cell transplant, patients undergo conditioning with high dose chemo or radiation to destroy diseased marrow. This makes room for new stem cells. Prophylactic antifungals are used because the immune system is suppressed, making infections more likely.
Mm-hmm.
The new stem cells are again infused, like a blood transfusion, and they travel to the bone marrow to start producing healthy blood cells.
Let's talk a bit about the risk of neutropenic sepsis.
Absolutely. Neutropenic sepsis is a serious risk when neutrophil counts are very low, leaving the body vulnerable to infections. Even minor infections can become life-threatening quickly, so prompt medical attention and treatment are crucial.
Mm-hmm.
That's why close monitoring and preventive measures are so important.
What does it neutropenic mean?
Neutropenic means having an abnormally low level of neutrophils, a type of white blood cell that helps fight infections.
Tell me again these drugs that are relating to this.
Sure, drugs like GCSF, granulocyte colony stimulating factor, can boost neutrophil production, reducing the risk of neutropenic sepsis. Prophylactic antibiotics and antifungals are also used to prevent infections during periods of low immunity.
Let's talk about graft versus host disease.
Sure, graft versus host disease, GVHD, happens when donor immune cells attack the recipient's tissues after a stem cell transplant. It can affect skin, liver, and intestines, ranging from mild to severe.
Mm-hmm. That makes sense. Can we go a bit
It's a
deeper into like GVL and DLI?
Sure, graft versus leukemia, GVL, is when donor cells attack residual cancer cells, which is beneficial. Donor lymphocyte infusion, DLI, involves giving more donor lymphocytes to boost this effect, especially if there's a relapse. Balancing GVL and GVHD is crucial.
Can we talk about DNMT3A gene?
Sure, the DNMT3A gene codes for a DNA methyltransferase enzyme, which helps regulate gene expression through DNA methylation. Mutations in this gene are common in certain leukemias and are associated with poor prognosis because they disrupt normal cell regulation.
What do we mean when we say leukemia is a stem cell disease?
When we say leukemia is a stem cell disease, we mean it originates in the hematopoietic stem cells in the bone marrow. These stem cells develop mutations, leading to the production of abnormal blood cells, which then proliferate uncontrollably.
Hmm.